I can't tell you what a pleasure and an honor it is to have with us today the Director of the Office of National Drug Control Policy, otherwise known as President Obama's Drug Czar for America, Gil Kerlikowske. I had the pleasure of meeting with Gil with Attorney General Bill Sorrell in D.C. a couple of weeks ago. And he learned a bit about what we were doing. We learned a bit about what he was doing and said, you know, what a great opportunity as we face the challenges that we're facing with addiction, opiate addiction across Vermont, to take some of the innovative ideas that Vermont is leading on and partner with the National Director of National Drug Control Policy and find ways that we can team up. We just had a really great conversation around this table with the folks that are helping to move the ball in Vermont. Obviously, they came from all walks of life. First of all, representing Vermont's extraordinary congressional delegation, all representatives were here, representing Senator Leahy, Senator Sanders, and Congressman Welch. We also had leaders from law enforcement, mayors across Vermont's communities are working so hard with us, treatment folks, families, the legal community, law enforcement, treatment, and as well as some of our extraordinary filmmakers who are helping us move the ball. In the conversation were Mayors Loris and Lozon, Sheriff Marcoux, Colonel Les Brown, you can hear from shortly, along with Commissioner Keith Flynn, T.J. Donovan, State's Attorney Chittenden County, Tris Coffin, our U.S. Attorney, Skip Gates, who we're going to hear from shortly, Dr. Harry Chen, my Commissioner, Attorney General Sorrell, Representatives Lippert, Chair of the Judiciary Committee, and Maxine Grad, Member of the Judiciary Committee, Bob Bick from Howard Center, Bess O'Brien, our extraordinary filmmaker, Lucy LaRiche was here from ACCD, our congressional delegation team, Jerry Fallon from New England HIDTA, Graham Cranenfeld, who's the state's attorney's representative, and Chief Doug Johnson, who's the head of the police chiefs for Vermont. And if I missed anybody, I apologize, but it was a great conversation. Really what this is all about is finding ways that we can partner with anyone who will help us to ensure that we are reducing the number of Vermonters who are suffering from opiate addiction. We all know it's a disease. I think our message is clear. Vermont wants to lead the way in treating this as a disease, move more folks from addiction to recovery so they can lead productive lives in this great state. We can reduce crime and maintain Vermont's quality of life. We want to talk today a bit about our efforts to ensure that we're getting naloxone. Did I get that right? Naloxone. Thank you. They're getting naloxone distributed across Vermont. We have a pretty ambitious program to get naloxone across Vermont. Naloxone is a drug that, if administered when someone is going through an overdose from opiate addiction, can save your life. We've already saved about 7 lives in Vermont by making this drug more readily available to folks who are suffering from overdoses. The health department has 2 sites operating in partnership with community-based organizations. Safe Recovery at the Howard Center in Burlington is one of our partners, and the HIC-HCV Resource Center in White River Junction. To date, we've given these sites 500 doses of naloxone, 400 at the Howard Center, 100 in White River Junction, and we're getting these distributed more broadly. The question is, how can we ensure that we succeed? The Howard Center reports that there have already been 4 cases where these kits have been on site, administered, and 4 lives have been saved. The next phase of the pilot is to involve expansion to the hubs in our hub and spoke program, our treatment centers, and creation for a mechanism of distribution to the entire population that's suffering from this disease. So I'm going to turn it over to a few of our folks who can talk a little more about how we're trying to advance the ball in this struggle. And I'm going to start with Vermont State Police Director, Colonel Tom Lesbrun.
Thank you. Appreciate it, Governor. Director, thank you again for traveling up from DC today. Thank you to the people that are behind us. And I mentioned earlier at the roundtable that the Governor's State of the State ripped the lid off of this conversation. and I mean that in so many ways, that the usual people that we're used to dealing with, talking about this issue, has grown significantly. We all have a voice, an equal voice at the table. I'm here today to talk a little bit about Narcan and the efforts that the state police are putting together to issue Narcan to all of our troopers. We started a project that really developed in December. The commissioner and I got together, and we have a tendency to make some difficult decisions. This was by far the easiest decision I've ever had to make as the director of the state police. We will issue Narcan to all of our troopers, to include our BCI folks. It's just a process that we have to go through to ensure that they're trained right, both on the front end and then the practical piece. We have a commitment from the Department of Health to work hand in hand with us, which is fortunate, because some other states struggle with getting their hands on a Narcan for law enforcement, but not here in Vermont. We're certainly going to move in that direction. I suspect in around 6 weeks we'll have all troopers trained in carrying. The only piece that we struggle with at the moment, because of the nature of the state's the weather conditions that we confront, both hot and cold, specifically cold, we need to find a way to carry it in and out of our cruisers and keep it on our persons. At the moment, we have 10 troopers, to include myself, who have Narcan readily available. We will work in the future to come up with some sort of practice that will allow the Narcan to stay usable. We're going to recognize the shelf life, and moving forward, I think it is well, I'll put it this way. Received an email over the weekend from a trooper who just arrived at an overdose, where an EMT had given the victim Narcan and brought that person from the jaws of death and breathed life into him. If one of our troopers anywhere in this state, in the rural sections especially, can do the same on any given day, then we're doing our job. We will balance that, recognizing that those who choose to enter this epidemic for gain, for profit, we will continue to focus, and we will work collectively with our law enforcement partners and our prosecutors to go after those that are in it for profit and gain. At the same time, recognizing across the state that if you don't know someone that has an opiate addiction today, you will in the near future. It affects all of us. So thank you, Governor, again, and Director Kerlikowske, and everybody in the room for just getting together and pushing this to the next level. Thank you.
Thanks, Colonel Westbrook. Thanks for your leadership. If there's confusion about what we're talking about, naloxone is the drug, and I think Narcan is the brand name for what we're distributing. I was told by my health commissioner that you got a demerit when you use the brand name in medical school. I didn't get to go to medical school, so we're talking about the same thing. On that note, let's turn over to our health commissioner, Dr. Richa. Where is he? Come on up.
So thank you. I want to thank everybody in this room. It really highlights the degree of collaboration and partnership that we're all working together on at the federal level, the state level, and at our local community levels, and even at the healthcare provider level. And as the state police, Colonel Lesperance mentioned, we're working with the state police, certainly with the goal of getting naloxone on every cruiser. I think that as an emergency physician, I really got to witness exactly how effective and how quick it was in terms of reversing the effects of opioids. 1 minute a patient would be unresponsive, not breathing, and blue. Administering the drug within 30 seconds to a minute, they're all of a sudden awake. So literally, this is a life-saving drug. It does save lives. It has saved lives and will save more. But I think it's important to highlight that how simple and easy it is. It's instructions, which I can share with you here, that will be provided to family members, to first responders, to safety people. It's 3 pieces: the drug, naloxone, and a way of administering it in the nose. And all this could be assembled within probably 15 seconds. And so our goal really is to provide this initially at these 2 pilot sites, with the 500 kits that are available. Next, to take all of our 5 hub sites, to make them available to the hub sites. Ultimately, to provide them for law enforcement within the state. And eventually, a physician in their office will be able to prescribe it. We just have to ensure that they can go to the pharmacy and fill it with all these essential pieces. We have all of this information in terms of the education available on the website. One fortuitous event was that in April, we're actually revising our rules for EMTs in Vermont. So an EMT in Vermont, as of April 1, can actually administer this, which is new. And so every ambulance in Vermont has to have an EMT on it. So therefore, every ambulance in Vermont, provided they had the medicine, would be able to provide this life-saving reversal. One thing I want to mention is that, again, tying this all together into a comprehensive system, healthcare, treatment providers, and public health and law enforcement, is the fact that on this brochure is 211. Because after you call 911 to get the ambulance there, after you give us, you want to call 211 in terms of trying to find a treatment provider. So all of that ties together, saving lives, getting more people into treatment for their chronic disease. And we're really looking forward to moving this forward. And I want to thank the legislature for taking this up last year to both ensure that we could actually administer this drug, because it's not a drug that is typically administered by a layperson, and that we also had the immunity to both administer it and also to call 911. So thank you very much.
Thank you, Commissioner. Now, just a couple of words. Great to have with us today Skip Gates. As you know, Skip lost his son to a heroin overdose and has been doing extraordinary things for Vermont in terms of educating kids, mostly, and other Vermonters about the perils of this extraordinarily awful disease. So, Skip, thanks so much for joining us.
Thank you, Governor. I'd like to start by commending the Governor on his focus on this terrible epidemic problem. I think the presence of the Director speaks volumes to the fact that I think we're heading in the right direction. My approach to the drug problem is through education. I did lose my son William 5 years ago this month. Since September 2011, in partnership with the U.S. Attorney Tris Coffin, we've visited predominantly high schools and middle schools to tell kids the truth about these poisons, to let them know that the choices they make have big effects on the rest of their lives, and to let them know what the score really is. We've done about 150 of these presentations thus far and believe that we really are indeed making a difference in kids' lives. I'm talking about making a difference. I testified in front of the Maine legislature, where I reside, 2 weeks ago in favor of our naloxone bill. I quoted Lieutenant Patrick Glenn from Quincy, Mass., head of the drug force there. He said that in October 2010, his force was equipped and trained in the use of Narcan, and in the next 18 months they experienced a 66% reduction in overdose deaths. I suspect a similar result will be experienced here. And again, I did testify 2 weeks ago in Maine, hoping that we can come up with our own form of the law. And again, I think we all need to be aware, and was stated earlier, if you don't know someone who's addicted to opiates, if you haven't experienced it in your family, you soon will. We all need to fight this front continuously to have any chance of winning. Thank you.
Thank you, Skip. Appreciate it. TJ Dunman, as you know, is doing his great job as state's attorney. He's also heading up our early intervention rapid response efforts and helping to get other state's attorneys involved in that effort. So I'm incredibly grateful to TJ for his efforts. If you're willing, TJ, to say a few words.
Thank you, Governor. Director, thank you for being here. You know, last week I had the opportunity to speak to Grace Keller and Tom Dalton, both who run the Safe Recovery site for the Howard Center in Burlington. It's a needle exchange where they also give out Narcan. I say Narcan, it's easier to say.
I noticed.
That's why they do it.
You know, and I want to give credit to both Grace and to Tom because, and I think Chairman Lippert, who's here today, would attest to this. They were the champions about making sure that Narcan was included in the Good Samaritan bill this last legislative session. It's really about saving lives, and it's just another example of Vermont leading the way of utilizing public health strategies to enhance our public safety. And in talking with Grace, she said something remarkable to me. She said they have about 40 unique visitors a day to safe recovery, which is again that needle exchange, another great example of public health, bringing down the issue of disease, whether it's hepatitis C or HIV, because of safe needle exchange. But more importantly, it's also a bridge to treatment from these places. And I think as Bess O'Brien said earlier today in our conversation, this is about destigmatizing people who are addicted to drugs and meeting them where they are and making sure that we have options available in our community when people are treatment ready. Not when we say they're ready, but when people say they're ready. And that's how we're gonna win this fight. And we gotta, as Skip said, we gotta do this from every possible place in the system, whether it's people in the community like Grace and Tom, or whether it's people in the courthouse like Emmett Helrick running our rapid intervention program, using science to measure risk and needs, not getting into the blame game, but really measuring somebody's risk to our community, and most importantly, their need, and linking them to the appropriate treatment facility in our community. That's how we're gonna win this fight. Governor, again, thank you for your support. This doesn't happen without the governor's leadership, without his speech, and without his continued advocacy on this issue. Thanks for having me.
Thanks, TJ. Finally, it's a real honor for Vermont to have with us the President's drug czar, Gil Kerlikowske. Gil gets what we're doing in Vermont. We just had a great conversation about how we can partner with the federal government, with his efforts, with his office, to get this one right. So, Gil, it's a huge pleasure to have you here in Vermont.
Thanks,
Thank
Governor.
you so much.
Let me also applaud the governor's leadership and the Vermonters that I met on this issue. And as many of you know, the governor's leadership extends beyond the borders of this state by co-chairing the prescription drug abuse and the opiate abuse issue for all of the national governors. Because in the position that I've had now for 5 years, I've had this opportunity to learn and understand this from both a national level, and then also to see that unfortunately it's a great equalizer. It doesn't respect demographics, it doesn't respect economics, it doesn't respect rural, suburban, or urban areas. It is a huge and significant issue. It is not only just the tragedies, the loss of life, and that's why I applaud Mr. Gates so much for his courage to speak out on this after losing his son William. But it's not just that loss of life, it's also a huge economic drain on this country. The cost of drug abuse is well over $193 billion a year. To prescription drugs alone and heroin, we lose almost 17,000 people in deaths. That's deaths greater than gunshot wounds in this country. The governor was kind enough in one of his visits to Washington to meet with us, and we are going to partner aggressively with him and with his administration. But then he was also extremely kind to extend this invitation, which I was happy to take, and then listen, and he had all of the right people at the table. It's not approached from a law enforcement standpoint. It's not approached from just a public health standpoint. It's realizing that you have to leverage all of those resources. If you think about unexpected messengers around this drug issue, I mean, listen to the public safety director or the head of the state police. They talk about this from a life-saving standpoint, about getting people into treatment. And we talk about it from an education, and then when you listen to Dr. Chin, it's very clear that the value added that all of them bring is extremely important. I'm just going to mention a couple other things, and then I'm sure I'm going to be happy to take questions along with the governor and others that are here. The leadership that's being done at the state level, the leadership being done by mayors, et cetera, is important. I can't tell you enough about how important the naloxone program is for first responders, including firefighters and EMTs who have worked very hard on this particular issue. And we've seen some great success. But we oftentimes, of course, realize that people who are, as Dr. Chin said, brought back from essentially the brink of death, often then take this as a life-changing experience and end up going into treatment. And again, if you go back to the economics, it's far less expensive to get people into treatment than it is to keep them in jail. And so that's why I think I applaud so much and was so pleased and so happy to hear from all of the people that were at the table today about what's going on. We want to work very hard to remove the stigma of people that are in recovery. This is a chronic disease. It's diagnosable. It can be treated, and yet we kind of have shunned it off over here. Because of the ACA, the Affordable Care Act, insurance companies are required to provide funding for drug treatment. And we know that that will not only save lives, we know it's, again, going to make us a more productive issue. I can tell you that when I first got the job with President Obama, and we had a discussion, and I said, you know, Mr. President, when I think of all of the things, and I think this would be very true for the Vermonters here, I think of all of the things that we talk about, police relationships with communities and healthcare issues, getting kids educated, having a productive workforce, as the mayor has talked about, having come from the business community, having an energetic, productive, and safe workforce. All of these things, you only really have to scratch the surface just a little bit to see that the drug issues are present. But frankly, I'm full of a lot of optimism and full of a lot of hope after having listened to everyone here about the approach this has taken. And again, I commend all of you, and I certainly commend you, Governor. Thank you.
Thank you so much. We'd be happy to take questions if you have them.
Are any federal funds going to be going towards this expanded Narcan usage?
Narcan has not been subject to federal funds, but I think you'll be seeing something very quickly from our Health and Human Services. A lot of drug treatment is paid for by an organization called SAMHSA, which is part of Health and Human Services, and that ability for some of the funds that states already receive to be able to use for that. The other thing, though, you should think about, this is less than $22. I mean, this really isn't that expensive. The training, and I think I can say this, the training is police-proof. I mean, you really can't foul this up. It's an amazing thing, and when people get in, have their lives saved, it's a wonderful thing for a police officer or a sheriff's deputy or a trooper to be a part of.
As someone who's dealing with this issue nationwide, how would you say Vermont is doing compared to other states with battling opiate addiction?
Well, there's some places that have not, as the colonel said, have not kind of ripped the cover off and have not looked at this for the horrific problems that it causes. It takes a lot of courage for a governor and for mayors and law enforcement executives and health officials to call this an epidemic, to call what the CDC has described as an epidemic, and they don't use that term lightly. But I can tell you that after several days in southern Ohio, West Virginia, eastern Kentucky, it was very clear that a number of elected officials at every level were more than willing to tackle this. And you know, in the rural and the more suburban areas, I think you probably feel it more painfully because everybody knows somebody whose family has been impacted, and I would guess out of that pool of reporters out there, you probably know some people here in Vermont that have been impacted.
Can you go through again the rollout of the Narcan, when it's going to go to the pilot site and the hub?
Harry, you want to take that?
So at this
Come on
point,
here, though, they'll be very disappointed.
so at this point, the two pilot sites, one in White River Junction, one in Chittenden County, have that drug available. We have limited availability on the state police cruisers, and our next conversations are with the hubs over the next couple of months to get them. I think our first conversation actually will be with Rutland as the hub, and then use that to mirror what we're going to do in the other hubs. Ultimately, we'd like to have a provider kit so a doctor can write a prescription for Narcan. They can give the patient or the family the education, and actually literally they can fill it with all of this equipment and the instructions at a local drugstore. I do know that in Rhode Island, Walgreens actually stocks this as a kit that you can actually buy that, and we're having some discussions with them about that. And in terms of the funding, the assumption is that insurers and Medicaid would actually pay for a lot, if not all, of the funding of the individually prescribed kits. But the ones that are being supplied currently as part of the pilot are being paid for by an evidence-based prescribing fund. Makes sense. Where we Medicaid bills pharmaceutical companies for the amount of business they do each year with Medicaid, and that's what's providing the funding for this.
Dr. Chen, Colonel Esperon spoke about our weather conditions here, the extreme cold, the extreme heat in the summer, as well as the shelf life. Do you know what our limitations are on this substance so that we can ensure that it's actually going to be effective when it's out on the roads?
So those are challenges that we commonly deal with, whether it be in a doctor's office with vaccinations, or whether it be in a pharmacy, in a hospital, or in an emergency department setting. So we certainly have all of that information available, and we'll work with the law enforcement and the state police to ensure that we have a system which will allow it to be potent when the time comes.
Do we have any idea how many of these kits have been distributed?
I believe we have about 140 kits that have been distributed.
And is there any concern of a possible unintended consequence? I mean, might the availability of this drug encourage people to use or discourage people to seek treatment if they know that this is out there? Is there any thought or worry about that?
What I do know, again, if using the goal of saving lives and reducing harm, that this absolutely makes sense, whether it be needle exchanges or opiate antagonist therapy. Clearly that is an issue you have to be concerned about, but I think the most important thing is to link the treatment, and whether it be in the emergency department, or link the treatment actually at the scene with actual more traditional opiate treatment.
Yeah, let me just mention also, at times people think that, well, this is so widely available and people will continue then to use drugs, knowing that even if they have an overdose or an adverse reaction, they're going to be saved and something's going to happen. I think if you look at the numbers in Quincy, Massachusetts, there are over 200 saves in the last, I think, 3 years. There is less than a handful of people that have had repeat naloxone. So many people, of course, end up going into treatment after having this pretty much a life-changing experience, and which then, of course, places the burden on the resources that are needed for treatment.
Mr. Kerlikowske, you said this is not a urban issue, not a suburban issue, not a Vermont issue per se, but what are you seeing done here that is different than what you're seeing around the country? Is there anything from Vermont that can serve as a lesson to North Dakota, to Illinois, to California, any place else?
I think the important part is the leadership that has been exuded by all of the people here, and the fact that you're looking at it in a much more holistic way. You know, we're people from United Way and their mayors and their sheriffs, their health department people, et cetera, treatment folks, and of course Ms. O'Brien and a film. I think that we have been very clear in the President's drug control strategy over these 5 years that the only way, as the state attorney said, that we're going to win this fight is to do this in a holistic way. And I think in a state the size of Vermont, you can serve as a model and a blueprint, and I think you already have.
Does the higher street price here in Vermont than, say, in an urban setting factor in at all as far as how we approach this here as opposed to in the city?
You know, I think that what we've seen is that the price of heroin fluctuates a great deal, and also the type and quality of heroin can also fluctuate a lot. The disease of addiction, once somebody has become addicted to an opiate, whether it's through prescription painkillers or whether it's through heroin, they're going to do, and we heard some stories about locally based crime, they're going to do whatever they can in order to get that. That's why I think the law enforcement component is huge and is important, and was voiced by everyone. But it's also important to recognize that treating someone, even if they've come in through the criminal justice system, things like drug courts are critical.
Can you help us put into context? I mean, there's been just a ton of attention lately about the drug issue in Vermont, locally, even a lot of national media stories. Is it worse here than it is elsewhere? Are we still doing better than other states? Can you help us understand the
So around the country, I mean, you often get the question of, like, what's our national drug problem? And what we say is, look, we really don't have a national drug problem. We have a regional drug problem. If you look at methamphetamine in the West, in the Midwest, but then you go to New York City and places in New England, methamphetamine is virtually unknown. So it's very much dependent on regions and this, and that's why when you look at the education and prevention programs, it's so important to help young people understand. And we have a group of young people, by the way, that are very naive about heroin, that don't even begin to recognize the deadly addictive principles around heroin, and don't believe that they'll become an injecting drug user, and of course that's what happens. So, but if you look at the education standpoint, young people want to be in control and they want to make decisions. And substances, including underage drinking, all of those things bar them from essentially doing exactly what they want to do. And that's why I'm so impressed when I listen to all of the people here that are involved in talking to people in elementary school, in middle schools, in high schools, and college students.
Many of us expect Vermont to have a legalization debate in the years to come surrounding marijuana. How, if at all, would that affect our efforts to combat opiate use?
You know, I think I'm going to dodge that question very much. I think many of you know that I'm in the process to move on to a different job at Customs and Border Protection if the Senate confirms me. So I think I'll stay away from that one.
What's the position of you and others, perhaps, on the issue of Suboxone? Some are now saying it's as much a problem as it is a solution. Do you have any?
Sure. We've heard. There are a variety of medication-assisted therapies. As you said, buprenorphine. There is Vivitrol. There is methadone that has been around for a long time. Are some subject to abuse themselves? It is quite possible. It is an issue, but I think the broader way to look at medication-assisted therapy is it has to be part of a system. It can't be just somebody going in for a dose or somebody just getting a prescription for buprenorphine. There have to be other resources, other support, other mechanisms. I don't know if Dr. Chin wants to comment or not on that part, but.
I would just echo the fact that the most important thing to take into consideration is that everyone who is quote-unquote using buprenorphine on the street, the vast majority of them are using them to stave off their withdrawal symptoms. They're not doing it to get high. They're just really more another manifestation of how broad and generalized this problem is.
Question for the Colonel. Can you talk a little bit about the training that's going to go into equipping troopers to carry the naloxone, and also how much that's going to cost to put it in every crew?
The training component is really basic, as the director mentioned. We spent some time with Dr. Robertson and the Department of Health 2 months ago going to a full day of training, but it will be narrowed down to about a 1 hour e-learning on one end, and the practical piece would take no more than 1 hour as well. So we have troopers trained that they can train the trainer. We went through that process last Friday. So those troopers can go out to each barracks and just continue the process to make it happen. The cost piece, as the Department of Health Commissioner mentioned, we're going to work in conjunction with them, shoulder to shoulder, to limit the impact that can have on the state police. But I think we'll find the money somewhere. The Commission is committed to this as well, and the Governor, so we'll find the money.
Do you have a dollar figure on how much it's going to cost?
I don't have a dollar figure yet, no.
Some local departments already carry this, is that?
Not in Vermont that I'm aware of, but we have the President of Chiefs Association and Roger Marcoux from the Sheriffs that we're going to work together to hopefully roll this out to all law enforcement.
Oh, okay.
I would hope to, but that's entirely up to them.
So it's not in any cruisers?
If a trooper walks into a scene and you've got an overdose, but you also have a criminal or a suspect anyway, what's your top priority going to be in that situation? Dealing with the criminal suspect or dealing with the overdose?
Saving a life trumps anything and everything that we do.
Even if there's a risk to the trooper?
The risk will be, there's always a risk when we sign off for duty, so if we walk into someone's having in an overdose state, that we will do everything we can to save that life and then take it from there.
Is this in any troopers' vehicles right now?
I have it myself, and we're carrying it in our coat pockets for now because the coats come in and out of the cruiser. We can't leave it in the cruiser, as the doctor mentioned, that they'll freeze. So moving forward, we have a plan that I think that we'll be able to attach it to our bulletproof vest, and next to a tourniquet and next to some equipment if needed for a gunshot wound. it will not hinder the way that, there's too many things on the belt right now, so we're gonna try to attach it that way.
And, sorry, the EMTs, do they carry it in ambulances already, or is this gonna be new?
It's for you, Doctor.
So currently in Vermont, under the previous rules, they're carried in ambulances with advanced level providers, meaning EMTIs, intermediate and paramedic level. As of April, that will be in the scope of practice for any basic EMT. And presumably the ambulance service has to then buy the drug for them to administer.
So listen, I'm gonna wrap, okay, I was gonna say, we're running late. We wanna get the director up to Howard Center, showing some of the stuff we're doing, so if someone's got one pressing question, let us know, otherwise we're gonna bug out of here. I've learned something from the director too today. I liked his answer. I'm gonna dodge that question.
Governor, can you just talk really briefly about your trip to Connecticut with President Obama to talk about the minimum wage?
Sure. As you know, the president understands that as we come out of this recovery and as we create jobs across America, I know we're proud of the fact in Vermont that we have the lowest unemployment rate this side of the Mississippi, that there's still too many folks being left behind in this recovery. Well, wages are finally starting to rise, jobs are coming back, we're leaving too many behind. What the president gets, and many of our regional governors understand, is it is not fair, it is not right to ask Americans to work a 40 or 50-hour week and still be living in poverty. And I don't think that there's anyone who believes that it's okay in the greatest democracy in the land to say to folks, work hard, we expect you to get a job, we expect you to work hard, you go out and do it, and you're making $14,000 a year, you've got to be on government assistance in many cases, you can't make ends meet, you can't buy food for the kids, you can't make it happen. So the president has put together a very forceful proposal that we raise the minimum wage in this nation as quickly as possible to $10.10 an hour, which would move you from $14,000 a year to roughly $21,000. Now, that's the right thing to do. So you're seeing governors across the Northeast embrace that proposal, and I'm looking forward to joining the president with many of the other governors to help promote this basic sound economic policy that's going to help the middle class, help working Americans have a chance at the economic opportunity that we all expect to have in America.
Thank you.
Governor, Health Connect went down briefly this weekend, March 15th, big day. Are we going to be ready for a push as folks who procrastinated jump on?
I didn't know it went down, to be honest. I do know this. As of this morning, you can make payments online, which we've been waiting for. That's a great development. We're continuing to make the rest of the improvements that will have our website humming. I'm proud to be the governor that has overseen a website that has more per capita folks signing up than any other website in the country. We're drawing down federal dollars that's helping people pay for health care they're struggling to pay for it. So we're making great progress. We're going to continue to make that progress. I'm going to hold our vendors' feet to the fire until we get it all right.
Thank you.
Thanks so much.
Good to see you.